Welcome to Taco Inc.'s Panel for the Parents webinar. My name is Madeline Hilliard, and I'm a co-founder and leader of Trojan Awareness Combating Overdose, or Taco Inc. To give you a bit of background, the goal of our nonprofit organization is to combat the epidemic of deaths among college students due to accidental drug overdoses. We've been successful in accomplishing this goal at USC since our founding in June of last year. And we do this by providing access to neutral drug education based in neuroscience and test strips for safe drug use. To clarify, our organization is neither pro nor anti-drug use. Taco accepts the reality that drug use is something all college students will be confronted with and aims to reduce harm wherever possible. Taco Inc. does not tell young adults how to live their lives, but rather provides them with the means to make well-informed decisions in the event that they are offered legal or illicit substances in the college environment. We sincerely appreciate you joining us in accepting the reality of drug use in college and being here today to become better informed toward having constructive conversations with your student or parent before leaving for the upcoming fall semester. To introduce our wonderful panelists, we have with us here today Dr. Susie Kim, who is a professor of medical education at Keck School of Medicine, USC. I personally have had the pleasure of having Dr. Kim as my professor in studying the brain in health and disease. We also have Dr. Michael Jakowec, a researcher and professor in Keck Medical School. He focuses on neurology and neuropharmacology. Both of them will be here to provide answers to any of your medically related questions towards drug use, as how drugs work, how addiction works, any of those topics. Also here with us today is the Chief of the USC Department of Public Safety, John Thomas. Thank you, John, for being here. John runs all of the Department of Public Safety to ensure that students stay safe at USC through a number of means. He oversees all of the officers at USC and also works closely with LA Public Resources to help transport students and get them medical attention in the event of an accidental overdose. Finally, we have Chase Espy, the president of the USC Interfraternity Council. He oversees all of the fraternities at USC in Greek life and helps them to run their organizations in a manner that is safest and healthiest for students. If you have any questions regarding drug use among students, common drugs that students may see, or what happens when a student may overdose, or resources available to students to help prevent these, those questions will be directed towards John and Chase. So to open this up now, if any of our participants would like to submit questions in the chat, you may do so at any time throughout the panel, and I will be happy to ask our panelists for you. So again, you can just type those at any time. But to kick it off, I would like to ask Chase, what are some of the most common substances that students will run into during their time at USC?
Yeah, thank you, Maddie. That's a good question. Obviously, the most common substance that you're going to see, I guess the two most common substances a student would see at USC is alcohol and marijuana, both, legal in the state of California, and it highly consumed across pretty much the entire student population. Another drug that is commonly run into that a lot of people coming to USC or coming into college don't usually expect to see is cocaine. I would say that there's a high likelihood that your child will have an experience with cocaine in their time at USC. Additionally, you have things like Adderall, which can be a tricky substance because oftentimes it's pegged as a study enhancer or kind of a brain drug, when oftentimes, as we know, that's not really the case. Additionally, you're going to see things like Xanax, are kind of any downers, primarily Xanax. And then also you're going to see Molly. And let me think here. I think that pretty much rounds it out. Psychedelics in a smaller degree, not as much as you're going to see really Xanax, Adderall, alcohol and marijuana, but psychedelics are definitely in there, and your child will most likely have an encounter with those as well during their time. But I would say those are the most common drugs that we see amongst students at USC.
Thank you, Chase. Chief Thomas, are there any among those, or just in general, what are the more common substances that you see students run into problems with or overdoses that may require medical attention?
You know, Chase, first of all, thanks for having me on this. Chase encapsulated pretty well. It's pretty current. I think, you know, where we see the issues is the mixture, you know, the mixing of alcohol or any of the other drugs that are combined, that's when often that prompts a call to DPS for a medical response. And our role is primarily first to preserve life. We're mostly concerned about getting that student medical assistance. And also our officers, as of about 2 years ago, began to also carry Narcan. So I think that the issue becomes when there's a mixture of those drugs. And oftentimes it starts off with alcohol, and then by the course of an evening that student may have ingested something else. And oftentimes they may not even know what that something else was that they ingested. So it becomes a very, very dangerous situation for us because we often don't know. And sometimes even their peers that are there with them don't know, because they may have just gotten back from one party and they just got to their house, and all of a sudden the peers, the roommates are calling and saying, you know, he or she is having an episode, and we don't know what the combination was. And oftentimes we don't know until after that has been determined by the medical professionals. So it's a combination of all of those things that Chase mentioned, but it starts with alcohol, and that in and of itself is a deadly combo with anything that Chase already mentioned.
Also, one I forgot to add that's becoming more prevalent, excuse me, it wasn't as prevalent when I started USC in 2018, but I've seen increased use over my time here, is ketamine, which is a sedative. That's definitely picked up in usage. I kind of, you know, it had always kind of been a joke before. I think like my freshman year, like no one really took it seriously. And then as I progressed, especially in the last year or so, I've seen a considerable amount of ketamine use, which has been interesting as well.
Yes, and that's certainly a substance that even without mixed use, as Chief Thomas was discussing, which mixed use is one of the most common causes of overdoses, ketamine on its own is possible to overdose on. So thank you for pointing that out, Chase. So we have a question from the chat that perhaps one of our doctors can answer. Is drug addiction chemical or psychological, or both? And does it depend on the specific drug?
Should I start?
Yeah, go ahead, Dr. Kim. Yep.
Okay. All right. So I think that's a fabulous question. I think maybe before we actually talk about this, just so that we're all on the same playing field, I just wanted to kind of go through the various categories in case parents weren't really familiar with the different types of drugs. So for instance, you know, the classification system, it kind of depends on who we're talking to, but for the purposes of this particular discussion, let's just say that there are basically 4 different categories in which students can be subjected to. And just as an FYI, I appreciate Taco inviting me to this talk. I too am a parent. I am a parent of 2 college students, one of whom is going to be a rising freshman. So I completely empathize with many of you parents out there. Going back to the categories of drugs, the first is called depressants, and it's because it depresses the central nervous system. So some of the drugs that we've been talking about, examples would include things like alcohol, Xanax, Valium, Prozac, et cetera, et cetera. And so as a consequence of depressing the central nervous system, what it does is, you know, the biggest fear is obviously respiratory depression. That's when kids really get into physiological trouble. The second category would be kind of the opposite effect. You would categorize them as stimulants. So in contrast to the depressants, what you're doing is you're actually activating the central nervous system. So as Chase had mentioned, the Adderall, the Ritalin, the ADHD medications would fall in that category. Methamphetamine and cocaine would also fall in that category. I would say the third category that Chase had mentioned is seeing, he's seeing in more use nowadays is the hallucinogens. So psilocybin, mushroom, LSD, presumably toad venom is now out there, is being utilized as well. So that's just something to keep in mind. And ultimately what happens with the hallucinogens is the fact that, you alter the sense of reality. And so that includes the sense of time and space as well. And then finally, you've got the analgesics. I know Maddie and the rest of the TACO organization is going to be talking about the fentanyl test strips later on. But essentially what happens with the analgesics, they're painkillers. And what they're going to do is activate and utilize the endocannabinoid, or the system of the enkephalins. And so the opioids, right, the morphine, the heroin, the fentanyl, those would be in the category of the analgesics. As far as cannabis is concerned, I think historically it was under the category of the hallucinogens, but in terms of its actual effects, it seems to just kind of have multiple effects. It really depends on how much you take, what other medications you're taking it with, and so on and so forth. I know the question actually asked about addiction. So according to the latest version of DSM, which is, kind of the Bible of psychiatry right now, is the latest version came out in 2013. It's referred to as the Diagnostic and Statistical Manual of Mental Disorders. Addiction is actually lumped together as a category called substance use disorder. And in the severest forms, we would, I guess, allude to it as addiction. So addiction has different properties in terms of the physiological component to it, as well as the psychological. I mean, rather than this being a lecture, there are, I would say, in essence, a component of both.
Thank you so much, Dr. Kim, for explaining the different classifications of drugs. It's very important to understand when discussing with your students, because mixing different classes of drugs can cause them to mask each other's effects. And the issue there is that the user might not be as well aware of how intoxicated they truly are. We see this a lot when you mix a depressant with a stimulant, for example, alcohol and cocaine. Both drugs, it's possible to overdose on their own. And when they're combined, it masks how intoxicated the person is by either one alone. So thank you for clarifying those. And yes, for clarifying that addiction begins psychologically and then really does become a chemical issue. Perhaps, Michael, you might be able to expand on that as well.
Yeah, I mean, in my class, you'll remember, one of the things that I have always thought was extremely important to understand is that psychology, addiction, drug use, diseases are all chemistry of the brain. There's no real essence of above and beyond the chemistry of the brain. That's really what you're getting into. And so I'm like, for example, I don't understand why psychiatry and neurology are two separate departments. Dr. Kim will explain that to me someday, but I just can't see it. But what that means is that this is all chemistry of the brain. This is a template that we use. And I think one of the things that, a couple of points to make in listening to the introduction, and I think this forum, I think TACO is doing a spectacular job, and I've got to know them over the last, I don't know how many, seems like years, but it's whatever. It's so ingrailed in what I'm thinking now that it seems like a long time. But the whole idea of safety, and I think that's really the driving force here of safety. And I'll give you some grim perspectives. First of all, 2 years ago, Maddie points out that 11 students died from drug overdose or drug interactions. One of them was my nephew at USC, died from what I believe was fentanyl. And that really sets a stage of something that I'll talk, let's see, those of you who grew up in the 60s and the 70s, we didn't have a problem with toxic exposure. It was to compare it to nowadays, I think it was fairly harmless. And whether it be cannabis or even some of the hallucinogens, they're all pretty harmless unless you overdosed by smoking every morning before class. But that's about what we saw. But I think your generation, Maddie and Jack and Chase and Rohan and the other students here, and your children are living in a world of potential toxicity, not just the political toxicity that we just went through, but the academic and the pharmacological toxicity. What I'm thinking of is the fentanyl problem. We had over 93,500 deaths in 2020 from fentanyl. We do often use the phrase, oh, this was an opiate or opioid problem, heroin problem. The thing is that probably of the individuals that die because of what we think is opiates and heroin are actually being poisoned by fentanyl. And I guarantee you, if you went into the streets of any city right now and tried to score some ecstasy or some cocaine, sometimes even marijuana now, it's laced with fentanyl. It's laced because it adds a degree of excitement. It adds a degree of kick to it. And when you get a kick from something, you go back to that guy and go, dude, I want some more of that. I got such an amazing kick off of that. You know, I'm the bee's knees at my friends. Let's do some more. That's the problem. And the problem is that fentanyl is a toxin, and it takes very, very little, almost barely visible amount of fentanyl to kill somebody. And so now what we're seeing, including what happened to my nephew, was who thought he was taking something harmless, ended up getting an exposure to something he never had before, and this toxin of fentanyl. Now, Maddie brings up another important circumstance, and that's the circumstance of mixing. Now, from a pharmacological point of view, and those parents who want to go back to school and take my class, I'll expand on this for 13 weeks and 29 lectures. But all I can say is that it's the mixing. And even though we think of the mixing as, okay, pharmacological mixing, that in fact there is also these types of interactions that I think of being more symptomatic. For example, 40% of individuals who die from opiate or fentanyl poisoning also had barbiturates aboard. And what that means is that it's not necessarily the interaction of two chemistries to create a third chemistry that's toxic. It's actually the symptomatic behavior of one drug and the pharmacological interactions of the other drug that leads to death. For example, what happens is that, in fact, when you take something like an opiate or fentanyl, you can get depression of your breathing. Now, that's not a big deal, except somebody who may have barbiturates aboard. And what they may be doing is sleeping. And they might be sleeping in an awkward position, like on their face or on the side. So they actually can't move. And they don't realize they're going to go into a state of hypoxia or a state of breathing depression that they can't kind of kick themselves out of. And so you end up seeing that this symptomology, because of one drug, is elevating the potential risks of another drug. And that's the type of thing that we're really concerned of. And I really got another point that I think is really important, is that we do know that our children are not adults yet from a neurological point of view. You're not myelinated, meaning that all your white matter is laid down until you're about 29 years of age. Jack and Maddie know this because they took my class. But what that means is that many individuals at the age of college, 18 to 23, sometimes even older, are in a very important developmental stage. They have pre-existing medical conditions aboard. We discovered this with COVID. Individuals that have breathing problems, asthma problems, things that you wouldn't see come out in the context of something like COVID. So in the context of a new experience, a new pharmacology, a new drug, it may bring some of these out. This is why we see asphyxiations, we see a number of things like that. So you get these pre-existing medical conditions that are elevated under these situations. We also are dealing with, except for some of our undergrads who have this amazing insightfulness and the frontal cortex is working at a level decades ahead of what it usually is, we have brains whose judgment, cognition, risk-taking has not yet matured to that of the wisdom of Chief Thomas, for example. So they're not quite there. So this is why we have these problems. And as my students know, it's good they have this problem because this is how man evolves. This is very, very important. But you have this risk-taking behavior that becomes part of who they are because that's what humans do. And this is why a 15 to 17-year-old Neanderthal will go off to find new lands when in fact their grandparents are going to sit around the cave. I mean, that's the brain's functioning. So we have, I'll finish in a second, we have all these additional things that are now coming aboard, the toxins, the comorbidities of compounding symptomologies, the whole idea of combinations, the pre-existing situation, the frontal brain of our young people, which not, you know, I don't care how good they are on the SATs, there are certain connections which are still going to be there that may give them risk-taking behaviors and things of that nature. So those are all kind of the things that I really think that TACO is also trying to bring out, and not just simply, oh, don't do this drug when you do that drug because then this could happen. It's deeper than that, and they don't, and they're bringing out and highlighting some stuff that I think is really, really important. That they could probably write a really good book on this someday. But I think that they're bringing out some really amazing potential things that we think about. So sorry about that long diatribe there, but.
No, thank you, Michael, for bringing up so many important points.
This is seltzer water, okay? Just in case Chase is wondering, okay? So lemon flavored seltzer.
But thank you for bringing up, especially the point about fentanyl. This is something that we've seen rise drastically in the last 10 years. Between 2013 and 2019, the proportion of drug overdose deaths that we see as being caused by fentanyl alone has quadrupled. It used to be in 2013, it was about a quarter to a third of overdose deaths were caused by fentanyl. Now we're seeing it about 3/4 of overdose deaths are caused by fentanyl. So this, as Michael pointed out, is why TACO, one of the functions of our nonprofit is to provide students with free access to fentanyl test strips. So if them or their friends are going to choose to use an illicit substance that hasn't been purchased from a pharmacy, they're able to use these test strips that take only about 3 minutes to use to be able to prevent accidental overdoses, as Michael was discussing. So
yeah, Maddie, could you tell us how those things work? I'm curious what type you guys have. So if you can just maybe run down some, I just scored 30 hits of ecstasy. I'm going to take them to the party tonight. I run into you on the quad. What do we do?
Yes, so these strips are very simple to use. We have instructions available on our website. I will put a link in the chat, but they function about the same as a pregnancy test. It's a little strip. They're really skinny. You mix like a couple milligrams, really the size of a strawberry seed, of whatever the drug sample is, with about a tablespoon of water. And then you just dip the bottom of the test strip into that mixture. You give it maybe a minute so that the mixture can soak up into the test strip. You lay it out flat, and about a minute later, you'll see either one line or two lines appear. 2 lines means the test is negative. There is no fentanyl in the drug sample. And from that perspective, the drug sample is safe to use from the fentanyl standpoint. If there's one line which appears very clearly, then that means it is contaminated with fentanyl. And these test strips are wonderful because even if that second line is incredibly faint, it's still a negative test result. And the test strips that we provide students with have been thoroughly studied and recommended for this purpose by Johns Hopkins University. So like everything that TACO does, our test strip program is backed by scientific research. So thank you for asking, Michael, and I will put that link in the chat.
Yeah. Also, just to carry that forward, is there some kind of test that you have for fentanyl that would be administered to a student who is unconscious or acting strange, or that you may utilize? Is there something like that that's available to us? Maybe inform our audience of that one.
Yeah, so what we try to educate students on, and what Chase, as the president of IFC, has been huge in helping us to provide this information to all of the new members of Greek Life. Each new Greek Life class, this began last year. We've gotten the opportunity to educate on what it looks like if someone has overdosed on fentanyl. So if, for example, if their friend says, oh, they took Molly earlier, MDMA, a stimulant, that causes pupils to dilate. Stimulants typically cause dilated pupils, whereas fentanyl, in an opioid overdose, you will see pupils become extremely pinpoint. So instead of being really the black part of the eye becoming very large, if someone said they had done MDMA, if you see their pupils are very tiny, that pinpoint, and they're either not breathing or breathing very slowly, you can safely assume that they have overdosed on an opioid. And in that event, you would administer, if you had it available, which we are actively working with numerous avenues at USC to make Narcan a wonderful drug available to students. Now, this drug has 0 side effects. I could give it to myself right now and nothing bad would happen, but it's a nasal spray. You just plunge it up someone's nose and that will block those receptors from the fentanyl so that the person is able to begin breathing again. If they were unconscious, you'll see them regain consciousness. So really what to look for there and what you can help your students remember is that if their friend has very tiny pupils and isn't breathing enough or isn't breathing at all, that would be 1, time to call 911 to get help, and 2, if they do have Narcan available, or just simply yell in the room, does anyone have Narcan? Because students like myself do carry it on them, that can be administered and be able to save a life. So that's something that Chase has been wonderful in helping us get that information out to a wider range of students. And thank you, Michael, for bringing up that point.
Yeah, maybe Chief Thomas can mention what resources his officers carry with them.
Well, we obviously carry Narcan, and actually we began to do that right around when we were seeing the overdoses. And actually, many universities across the country, and I can definitely speak for the other 11 universities in the Pac-12, because we talk all the time. That's when we all began to start seeing this rise in overdoses with fentanyl. So I don't know exactly what was the cause, because obviously opioids were around and students were using opioids prior to that, but like a wave toward the end of 2019 or fall of 2019. But we certainly carry Narcan, and we just got a fresh batch last week. The benefit that we have is we work closely with the first responders, LA Fire 15, which is right adjacent to 28th Street, right on Hoover and 30th. So they're well versed with what are some of the common medical ailments for our student population, and they are well versed and very responsive to the calls for medical assistance when students have had an overdose. So 1, we do carry Narcan. We have extensive training to deal with what typical drugs that cause overdoses in our community. But for the most part, it's training, Narcan, and then a reliance on our good partners at LA Fire Department 15, which can get to anywhere in our community actually within less than 5 minutes.
So Chief Thomas, if you'd like to take my class, I talk about the history of fentanyl, and you will know why we have this problem now. But actually, I was thinking about if any of your officers want to drop in, and during my fentanyl class, I give 2 different lectures in 2 different courses. I'd be very honored if
well, I would join, and I would encourage our officers to.
And there'd be no test questions. Okay?
That's a good thing.
I'll email you about that.
Please do.
Yeah.
So we had a question in the chat just while we're discussing the Narcan and fentanyl test strips as to where students can get fentanyl test strips from TACO. We do pass them out by hand every week on the row. on Fridays during the school year from 11 a.m. to 1 p.m. They're also available through our partner distribution service called Duffel. So you can go on duffel.com as a USC student and get fentanyl test strips delivered to you in 10 minutes or less between the hours of 3 p.m. and midnight. So in this way, students, if they need them, they can get them very quickly. And we are also now in the upcoming weeks going to be expanding this distribution program so that students at UCLA have access as well. So if we do fundraise to be able to subsidize these fentanyl test strips, so if anyone appreciates what we are doing with that and would like to donate to our organization, I just would like to point out we are a 501c3 registered nonprofit organization. So all donations are tax deductible, and they will go towards saving lives through the use of fentanyl test strips.
And just to add on to that, Maddie, and maybe Chief Thomas will know this a little bit more, but Michael had mentioned the fact that the quantity of fentanyl that you need to use, it's a white powder, is so substantially less than what you need for other drugs. And my understanding is the reason why you're seeing it more often now is that they're packaging it. So the drug dealers are actually synthesizing it and incorporating it. So therefore, if your child is thinking that they're taking one drug, they may actually have additional, fentanyl on it, which is, I think, and I don't know in terms of percentages, what leads to the overdose, but that is something that students or children might not be wary of when they're taking a pill, that there actually is additional fentanyl laced onto the drug that they think they're taking.
That's an excellent point, Susie. Thank you. Yes. So the amount of fentanyl it takes to kill really any human is 2 milligrams. It's an extremely small amount. For reference, the average bump of cocaine that someone would put on the end of a key is about 50 milligrams. So it can be very easily snuck in there. And as Michael had mentioned earlier, the reason dealers do this is because then it gets the user hooked on that one supply. Fentanyl is an opioid that's 50 to 100 times stronger than morphine. It's extremely addictive. So if someone were to accidentally consume, say, 1 milligram of fentanyl with their cocaine, if they were to do that, they wouldn't know, oh, I've just taken fentanyl, and they might not die from it, but they would become specifically addicted and want to go back to that specific dealer to get that supply again because it gave them the best high. So that's why dealers do that. And this is information that we have provided through our Instagram account, and it's available on our website. And we do try to make all of this information that's being discussed available to students through social media and our website to make it as easy as possible. And it's all based in academic research. But yes, fentanyl is an extremely dangerous substance that unfortunately we are seeing more and more because it's completely synthetic, very inexpensive to produce, and it helps the dealers make more money easier. So that's really what we're trying to combat here. And in unfortunate situations, it can get into even marijuana. One of my partners at work, one of his good friends, just bought some marijuana not from a dispensary. And unfortunately, the dealers had been packaging that marijuana on the same table where fentanyl was also distributed. And as I said, it only takes 2 milligrams. So it got just a little bit of it on the marijuana, and that was enough to kill him. So it is very, very important to educate your child before they go off to school that if they are going to use a recreational drug, they should test it. Always, 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 always test it. Because at the end of the day, what our organization does, we understand that people are going to use drugs. The main goal here is that they wake up the next morning and are still alive, breathing, and can go back to class. So as your students go away to school, please let them know that this service is available to them, that they can go on duffel.com and get these fentanyl test strips to them in under 10 minutes. Duffel, we give them out for free. Duffel provides them for just 1 cent. So they are extremely accessible. And yes, I will link that. It's also available on our website. If you click on test strips, it'll take you straight to duffel to be able to order those. And again, they can get those 7 days a week from 3 p.m. to midnight. So really anytime that them or their friends might consider using drugs, this resource is available to them. So thank you for bringing that up.
Yeah, the other thing, Maddie, is to mention is the fact that unfortunately there is some misinformation out there. One of them is that you yourself may get infected or sick or exposed to fentanyl from somebody that's overdosed or exposed to fentanyl. There's actually a training video, I think Chief Thomas probably saw the video already, that was being used by the San Diego Police Department that created this wave of fear that you have to be careful, or that we see hazmat people go into rogue chemistry labs with a full gear on. That makes sense because you don't know what you're stepping on, and there's all kinds of fumes in the air and things like this. But when you have an individual who is exposed to a drug like fentanyl, going through the symptomology of that, you yourself cannot get sick from them. Even if you gave them mouth-to-mouth resuscitation, you're not going to get exposed to that. And I think the other thing is that, I don't know, Chase, maybe you can comment on it. The idea that, what do you guys look for at, I mean, I don't know how old you are, Chief Thomas, but there used to be a thing that I've heard, I read about this. I'd never experienced any of this, of course, but I used to read about a person called a wingman. Anytime you did something a little bit, dicey, you'd have a wingman. And the wingman's responsibility would be to take care of those who are not taking things, to make sure that whatever it was, that you've got safety. Is there any thought, two things to Chase? One is that within the fraternity, within the USC community, I don't just say the fraternity, but because you got some houses around there that have more people in them from USC. I've got 3 kids there. But the thing is that, do you have the concept of creating a wingman at parties and things like that, to survey, and also to be aware of what it is to look for in someone who's been exposed to other opiate or fentanyl? For example, I do know from firsthand, and then my nephew who passed away was doing things that were kind of, he wouldn't respond. He was frothing at the mouth. He was snoring extremely deeply very early in the evening, things like that. Unresponsiveness to even being shaken or moved. Chase, maybe you can comment on some of these concepts.
Completely. So the concept of a wingman we have in the fraternity system is, that's your risk chair. And for a large part of my college experience, that person was me. So I would get a call at 2 a.m. We got a kid passed out on the couch. His breathing he's got really shallow breathing. He's not doing too well. I would, at 3 a.m, I pick up the phone from my apartment, come over to the fraternity house, make sure they're okay. What did he take? Really just kind of stay with them for the night. And then if need be, I was the one that would take them to the hospital, call 911, the whole 9 yards. So that exists in every fraternity to some capacity. And that's the risk chairman. They're elected usually as the most responsible person in the fraternity, and their job is to take care of members. Previously, before Taco and kind of before my time on IFC, these risk chairs were really not looking out as much for drug overdoses. I mean, it wasn't a part of their job description. It was just kind of something usually inherent to them. But now with the help of Taco, we're really expanding that. And we are teaching our risk chairs actively throughout all of our houses what to look for a drug overdose. And to build on that also, I know specifically for my chapter, Pi Kappa Alpha, we are designating room both for Narcan and fentanyl test strips within our chapter facilities, which we think is going to be really great. I mean, there's no excuse not to test your drugs when you can walk down the hall from your room and get a test strip and get it over with like that, which we're really excited about. We're also going to be partnering with Taco to try to get Narcan in every fraternity on the row. That's something we have not been able to do previously because of COVID and not, distancing, not being able to meet in person. But as we get back on campus, that's going to be one of our main priorities, is getting Narcan in every fraternity house and having a group of people that are trained and going to be at the house at all times. Your executive board, your presidents, vice presidents, risk chairs, social chairs that are going to be able to administer that if something goes wrong. But that's something we really want to ramp up. I love the idea of a wingman because I fall into that role a lot, not even in my fraternity, but with my friends. And I'm kind of the guy that's always on lookout because I don't use drugs or alcohol. And then just to kind of go off that, it's not a matter so much as if your kids are going to see these things, but when your kids are going to see these things. I personally am the only person that I know at USC that doesn't use drugs or alcohol. And the only reason I don't use drugs or alcohol is because I previously used drugs and alcohol too much. So they're going to see it. They're going to be exposed to it. I'm from Kansas City, a Kansas City suburb. I had never been exposed to cocaine in my life. Rohan knows very well in Overland Park, Kansas, we don't have a lot of cocaine. But my sophomore year of college, I'm walking into my apartment and there are lines of coke racked on my kitchen table. You're going to see it. I have great friends. You're going to see it. But what we're really trying to do in our partnership with Taco and just for the entire USC community is making sure people are doing these things safely, because there's nothing in your power. I know you probably hate to hear it as parents. There's nothing that you can tell your kids that is going to stop them from using drugs or seeing drugs or trying drugs. It's going to happen. And, I have been there. I have seen other people that have been there. It's what you do in those situations, or what your kids know to do in those situations that's gonna really be the defining factor. And if they wake up in the morning, because this is rampant, fentanyl is rampant. It was rampant in the IFC community, and it's terrible because it's so preventable. And from this point forward, Taco's done a phenomenal job since they took over. There have been 0 overdose deaths at USC, which is amazing. And we want to keep that number going, because there really is, with the resources we have now and the education that they're providing us and the education that USC as a whole is providing us through RSVP and through Taco and through the support of DPS and Chief Thomas, there's no reason a kid needs to die of an overdose. And that's what we're trying to do. And we're trying to spread that as far and wide as we can. And, obviously I'm in a sector in IFC that is overrepresented in drug and alcohol use objectively. So we think that if we can, I believe I should say that if I can, and Rohan as well, he's my vice president of health and wellness at IFC. If we can work together to eliminate these situations in our community, we're making a massive impact on preserving the life and the well-being of our students. And that's what we're trying to do. I know that I have fentanyl test strips. I see Maddie and her team saw them every day during school when I was walking down the row, and they were handing out test strips. I took test strips back to my apartment. They're free. They encourage you to take them. There's really no reason a student shouldn't have them in their room. And again, that's why it's going to be so important to donate and make sure that they're well funded. Just because it's such a vital part of drug use culture, should be at least using drugs safely. Yeah.
The other thing I just wanted to mention is that, so we don't go off on the wrong tangent here of thinking of fraternities as the I'm trying to think of a nice term for it, but the originator of a lot of bad lifestyle. One of my co-students at Yale was probably the best illicit drug manufacturer that I ever knew. So it happens everywhere. But I think there's a question here. How do you talk to your children about this? Well, I like to think that some of our professors try to do that too, because it's easier, because I think it's much easier to listen to a non-parent than it is to listen to a parent. And so we try to, at least within the context of the classroom, and I also would like to see Taco and its education and insights to also go into the non-fraternity, non-sorority population. For example, coming to a biology class, biology 220, and which we do talk about drug addiction, but also to see real life. And certainly in the context of my course, and I think Dr. Kim's course, we try to show students real life things, whether they be in videos or real life experiences that we've had. And then we try to talk to them about that. And I really encourage our students to become colleagues of the professors, and to ask them questions, not to be the second parent, but to also to be a source of information for things like that. And I think it's really important. So chemistry departments, what do they have? Lots of chemistry. Taco should be talking to them. Believe me, nerdy guys are as prone to drug use as the coolest kids on the road. Don't get me wrong on that, because I won't let you know what category I was in, but it's everywhere. And we won't get into some of the jokes at Keck School of Medicine as to how high drug addiction can go, but it can go pretty damn high to 5 floors. Those of you who know that joke will laugh. The others will go, "What the hell is he talking about?" But it's in the history books. But I think, so Maddie, maybe you can tell us about some of the focus that you're also doing that goes into the let's call it the general USC community, and not just the Greek life community.
Can
Yeah,
I
so
say
we
something? Can I
have-
add something? Because there's a couple things I want to make sure it gets out there. One, our approach at DPS is not about enforcement. I want to make that very clear. And I got to give IFC some credit, because I now have 15 years worth of IFC presidents, Chase, and your predecessors have always worked closely with DPS, even with amnesty. And one of the things I want to say is we have made it very clear that a student will not get in trouble if you call DPS on behalf of someone who may be experiencing an overdose or whatever medical, even if it's alcohol poison. We learned, and actually it was IFC years ago when they said, Chief Thomas, we have people showing up at our parties that are already intoxicated. And what do? We don't even want to call DPS, because if we call DPS, our house is going to get in trouble. So that's where we worked, and we put together amnesty. And thank God we got amnesty, because now it's broadened into, substance abuse. So I don't want a student to think ever, because what we used to have before was students that were not calling DPS and not getting the medical attention for other students, or having a student, putting a student away to bed and finding out later they overdosed or asphyxiated because other students were too concerned about getting in trouble. Students need to know we took that off the table years ago, but I still hear students say, well, I don't want to call DPS because I don't want to get in trouble. I don't want to get my house in trouble. I don't want to get that's not even something that ever comes. And my commitment has always been, if that happens, hold Chief Thomas accountable, because I'm more concerned about the safety and well-being of a student. And what I had to learn through our students was just what Maddie has said repeatedly. We're not going to stop students from recreational drug use. So our posture at DPS is we're going to, one, ensure that there is no stigma or repercussions for any student who calls and requests assistance. So I wanted to make sure that's very clear. And I have to say that my mindset and our mindset as a department has had to change over 15 years as a result of listening and learning from students like Maddie and Chase and Rohan. So thank you, because it is a partnership that is predicated upon wellness. And if we're talking about a safe community, a safe community is not just a safe community from crime. A safe community is also a community where we care enough about those people that, who may choose to partake in recreational drugs, and there's no stigma or no judgment. So I just want to make sure we're very clear on that.
Thank you so much for bringing that up, Chief Thomas. As we do reach 7 o'clock, we can keep going if everyone would like to, but if there is one critical point that parents take away from this session, it is to please tell your children as they go off to college, if you call 911 in the event of a drug overdose, or if you call DPS, even if you think they might have overdosed, even if your student themselves is intoxicated, if they call 911 or DPS first, DPS has an amnesty policy, 911 has the Good Samaritan law, they will not get in any trouble. They will be completely legally protected if they call 911 if they think their friend is overdosing. If there's anything that you can tell your student before they go off to school this fall, that is it. Now, it's also important to emphasize that if they don't call and someone does die, then the police are going to show up and then someone's going to get in trouble. So truly, it is all around in their best interest, both from a health perspective and from a legal perspective, to call for help if they think they might need it. To help in this type of situation, we make it available on our Instagram and the front page of our website, a nice little flow chart that students can go through if they think someone may have overdosed and they're wondering, should I call 911? We have a flow chart you can go through, answer some yes or no questions. And if the answer is yes, right at the bottom, it says, here's what to say when you call 911 or DPS. I have a medical emergency. So if there's anything else that you can tell your students before they go off to school this year, it is that if they think someone might have overdosed, call for help. It's in everybody's best interest. So thank you so much for bringing that up, Chief Thomas. As we are reaching the end of time, there's one other important point that I do want to bring up is addiction. So if a student does end up struggling with drug use and isn't able to stop drug use, what resources are available and how can parents go about that situation in a manner that is most likely to have their student successfully recover from it?
I can take this one because this is something I've had personal experience with. I did in my first 2 years, I did abuse substances at USC. I had a substance abuse problem, and it was difficult. It was something that really, for someone to stop using substances, it's almost always a decision that they have. I would say probably always a decision that they have to come to themselves. And it can be very difficult to see an individual or a friend or a child go through that. And having very little that you can really do about it. So I would say that the most important thing that I want to bring home about addiction, and especially helping someone who's experiencing addiction, and I think there was I saw a question in the chat about this as well, is offer support and offer resources. And there are some there's incredible resources for drug and alcohol rehabilitation and recovery in the Los Angeles area. I'd say probably it is the best city to get sober in the world, just because of all the resources that are around. I know that myself, I'm going to be putting together an information packet that, friends or parents or anybody concerned, or even students that feel themselves struggling with addiction can utilize. It's a list of rehabilitation facilities, other students that have gone through the same things as them and can offer advice or counseling, different therapists or people that they can engage with that would be under the USC insurance plan, and then recovery programs, Alcoholics Anonymous, Narcotics Anonymous meetings. There's an Alcoholics Anonymous meeting on campus that meets every single day. So these resources are kind of everywhere. It's just taking the steps to engage and look for them. And I'm really hoping during my time at USC and on IFC to be able to make these resources widespread, because there are a lot of students that suffer in silence with this. And it resides under this guise that, I'm just in college. It's only 4 years. That's what I thought when I was here. I go, it's college, I can go crazy. I'm free from my parents. I can do whatever I want. This is what college kids do, right? And I very quickly realized through, the help and the support of my friends and my family that I was on a path that would probably lead me to death. So I had to do something. And if it wasn't for the support, I will say this, non-confrontational support and the offering of resources from those closest to me, I probably wouldn't be here today. And it can be very difficult to engage with someone who is actively in the throes of addiction. Often, as we've said, addiction is it's all about neurochemistry. That drug to them is survival. It's not just it's not simply something they do to enjoy. It has now become synonymous with being alive for them, and they oftentimes will prioritize everything above, the drug will be above everything else, which can cause a host of problems in socialization, all these different things. So they will oftentimes get defensive if you try to approach them. So that's why in my opinion, from what I've observed, it's very important to just offer resources, which is what we're trying to do in IFC and at USC with Taco at an institutional level, just so students are aware. And if anybody needs it, it's always there to help them.
Yeah, I think, Chase, you bring up a really important issue there, that in fact, when you are in the grasp of addiction, taking, just like in the grasp of alcohol, is that it's used not to give you a high, it's used to make you normal and to achieve normality. So those of you who are old enough to remember hanging out with Lou Reed at the Chelsea Hotel, my inside joke, of course, is the fact that it's just used as the new normal. And so, or to stay normal, and that the driving force is a negative driver. And the question that, and one thing that I try to emphasize in the class and emphasize at all stages of life, one thing that we study in the lab is brain plasticity, brain change. The brain changes at all stages of life. It's constantly changing, including when we're old and think everything's done. No, it actually can change. And then in fact, addiction, use disorders, whatever they may be, are a stage that the brain enters. And it can also exit that. And you can exit that because of other things that are used to drive the neuroplasticity. And this is why behavioral modification is so important. This is why context of your environment is so important. This is why reinforcement. The brain has to relearn what the previous normal was, or to learn a new normal, so that it can in fact be non-addicted. And so this is the type of thing that we try to understand from in the lab, the effects of exercise, the effects of other forms of pharmacology. And this is what we study and do research on. And in fact, these are very important. And they can be applied at any phase of life and at any stage of life, whether you're an 18-year-old taking MDMA or whether you're a 74-year-old hooked on opioids. It can be applied to that. And I think there are a lot of resources. And again, as Maddie and Jack and other members who founded TACO, yes, they sometimes say this is all based on science. Yeah, it is. We've got the papers to back it up. So this is really reinforced by that. And it's the science that's really guiding us to what the solutions are. And it's a lot of work. It's a hell of work, but it is quite possible. And so I think people like Chase and other students are examples of that. And some people don't get realize until they're in their 40s, 50s, that they need help because of the environment they're in. Chase was lucky to see that at age 19, 20. It's spectacular. I'd love to read a biography of yours someday. You can write and put in the paper. I mean, that would be, the student paper would be a great thing to share with us. So it's quite amazing. Yeah.
Thank you so much for that discussion. Although we are at time, we did have one question, if our panelists are willing to answer, that I think is important for parents as their kids are going into school, because really at baseline, what kids are most likely to be exposed to and the drugs that are the most normalized in college are those that are both recreationally legal for adults over 21 in California, which would be alcohol and cannabis. So a question for our doctors would be, what are the relative consequences on brain development for young adults, on the body, what are the pros and cons between those two substances that students are going to run into the most, and which ones are most likely to have that negative impact on brain development, and in what aspects?
Well, I guess piggybacking off what Mike had mentioned with regard to alcohol use in the past. So for both of them, I think, in terms of the frontal lobe in particular, where you've got the development of judgment, it's still a continuous process that keeps going even through their college days. And so as far as brain development per se is concerned, I would say that alcohol is a toxic chemical. And so consequently, regardless of when somebody ingests it, it is going to kill brain cells. As far as cannabis is concerned, I think up to this point, we don't have any definitive answers, because obviously it was an illegal drug until relatively recently. And so I think we're going to be acquiring more studies and data as we go along. All of that said, what I will tell you is that there's another course I actually teach 6 classes at SC, one of which is called the Neurochemistry of Addiction. And in that class, Dr. Steve Siegel, who is the chief of psychiatry at Keck School of Medicine, one of the things he does mention is that even though there is a relatively low percentage rate of people developing schizophrenia, it does increase with the use of cannabis. And I believe there was another question that talked about auditory hallucinations that might be associated with use of cannabis. So as I'd mentioned to you before, historically speaking, cannabis is considered to be a hallucinogen. And so, psychosis and the possibility of increasing one's risk of getting schizophrenia is something that's tied to the use of cannabis.
Thank you.
Yeah, absolutely right. I think the other thing, there's a couple of issues here. Is one is that's really, first of all, I agree, we have very little research. And because of research in all of these drugs was really actively suppressed. Those of you who are fans of Nixon, I apologize for his actions in the early 70s, but that is a big problem. We have so much exposure and utilization of cannabis, but we have only anecdotal data. It was actually suppressed in terms of research in it. We're starting to get new research now and understand it. But I think a couple of points. One is that drug use, whether it be alcohol, cannabis, these other types of drugs, change the brain chemistry, to change the brain's connections. They also can reveal, let's call it maladaptive connections or pre-existing connections. And this is where schizophrenia, we don't know exactly if it reveals something that's already there or could be there under the right circumstances that would be revealed only under certain circumstances, or does it actually create a new situation that didn't exist until the drug use? And so that's an important question. But we do know that in all of these pre-existing or persistence of these different types of anxiety, depression, schizophrenia, OCD, all of these types of symptomologies coexist in many types of neuropsychiatric issues. The other thing is that the young brain is exposed to, the adolescent brain, which we know is about the ages 12 to 29, is the risk of activities that the brain experiences that include binging. Binging is a really nasty, nasty event. We tend, after a certain age, not to binge. None of us go to a party and drink 6 bottles of Dom Perignon and jump off the roof. That tends not to happen. However, in the young brain, the risk-taking, the judgment, the exposure, the lack of wisdom to the delay onset of the pleasantry of a drug can also lead to binging. And when you have binging, you can actually begin to change the chemistry of the brain in a way that you may not experience in moderation. So even though Oscar Wilde said moderation is good for you, especially moderation of your moderations, but the fact is that that's a very different experience. So yes, everybody's going to be exposed to drugs in some fashion. The question is, you're going to have such a dichotomy of how much exposure and what experiences will that lead? Why are certain individuals more addictive than others? We don't necessarily know the exact reasons. A lot of it there are addictive behaviors. We can say, oh, it's all dopamine. You got high dopamine, you got low dopamine. Okay, that's the reason. But it's much more complex than that. Behaviors are extremely important. Experiences are very important. The reward system, which is robbed by drugs and utilized, instead of you being getting great pleasure from eating something like a mango on the Serengeti 20,000 years ago, it's now a line of Coke. The brain doesn't know what this is. The brain knows that it just received an experience that led to a dopamine flux that was like, wow, this is really good. Let's do it again. Do it again. Do it again. Let's make it a part of our permanent behavior. And instead of finding food on the Serengeti, it becomes finding a line of Coke somewhere in your surrounding community. So all those types of things can be. So the young brain, unfortunately, maybe we should hold off college till you're like 30. And that way, when you go, you'll be like, it's like my friends, I say, once you hit the age of 60, go out and do some heroin. No problem. You're not going to get addicted. However, if you're 18, stay away, because you're going to get addicted, because the young brain is so susceptible to addiction that and that's good, because that's how we evolved. You want to get addicted to things that are good, like eating and reproducing and finding safe caves and avoiding saber-toothed tigers. That's the brain. However, in the context of cocaine or these other drugs, that's when it becomes a real problem. So the adolescent brain is just, it's an amazing tool, because these guys are going to go into science and engineering and businesses and law, and they're going to reveal amazing things and new ways of thinking. But at the same time, that's a template that's susceptible to these other nasty things that are out there. And the question is, can we help guide that with wisdom? We're not going to guide it with barbed wire fences. It's going to be, hopefully, that's one thing I try to tell our students. I try to tell my kids is to give them an armament of wisdom, so that they can know when they are faced with something, they say, well, I really don't want to, I don't want to sniff that nitrate. I'm really not interested. Let's hold back. I don't need that. And also to have the judgment of how far to take it. Let me taste it. Not for me. Okay. This is a type of experience and wisdom you hope happens. And unfortunately, we do get exposed to larger inoculums of drugs, and can you get through it? And obviously people like Chase, yeah, it's very possible to get through it, and very possible to become a completely different person because of it. It's really important. So yeah. Mm-hmm.
And just to piggyback off of what Dr. Jakowec had mentioned, this is something that I've imparted to both my students as well as to my own children. And there's this notion called prospective hindsight, which is kind of putting yourself in a circumstance ahead of time and kind of thinking through what might happen. And so that's not to say your kids for sure will be exposed, well, will take drugs, but they will definitely, as Chase had mentioned, will be exposed to it. They will see it. And that's just kind of what happens in college. Question then becomes, can they put themselves in that situation ahead of time and kind of go, in that circumstance, what would I, or what do you think I should be doing or I could be doing, and kind of playing out the scenario in their heads ahead of time so that they may not necessarily make these, brash decisions kind of on the spot. And so maybe it means taking the fentanyl test strip ahead of time to see whether or not it's going to be laced with fentanyl, to see what it is that they're actually getting exposed to. And just to kind of lighten things up, the one thing I will say that was really beneficial for me as a parent, there's a beautiful book by Julie Lithcott-Hames. I'm sure some of you guys already know about it. It's called How to Raise an Adult. It helped me immensely as my kids were going from, transitioning from their 20s. My son is now just turned, the teens into their 20s. And so, I think there are a lot of resources out there for not only your own children, but also for parents as well.
Thank you so much for sharing that, Dr. Kim. So what Dr. Kim was mentioning about prospective hindsight was a wonderful point that she made in a class I had with her, but it's really what TACO is about as far as encouraging that prospective hindsight. The reason why we provide this open access to information about drugs, both the positive reasons why people might choose to use them, the risks involved, what they look like, what a lethal dose looks like, all of these things is really to encourage that prospective hindsight so that students can have the ability to make informed decisions. When someone offers them a drug, they can think about, okay, do I want to take on these risks? Am I going to want to deal with these issues tomorrow? What is going to go on here? And really be equipped with that information. And so that's why we're encouraging you as parents, although it seems daunting and something that as your children were infants, something you never hoped to have to talk to them about. The reason why we're encouraging you to discuss drug use with them is to encourage that prospective hindsight so that when they get put in these situations, as we all understand now they inevitably will, that they truly feel equipped to make that best decision, that they know what they're doing before they do or don't do it. So thank you for bringing up that point, Dr. Kim. And since we are a bit over time, I want to offer to the panelists if anyone does have any last ideas they would like to share before we go.
I would just, I applaud you, Maddie, and the TACO for what you're doing. It saves lives. I've seen firsthand. I know the potential. I don't ever want to go through a devastating period as we went through in 2019. So I am steadfast in DPS as partners with you, TACO. We have been a partner with IFC for many years, Chase. So, you all have my number, 24/7 accessibility. So please keep us in the loop with what you're doing and consider us partners.
Thank you so much.
I just want to add, there's a lot of dark pictures that we painted this evening. It's not that bad. One thing that I find absolutely remarkable is the intelligence, the integrity, and the commitment of the students and the student community at USC. It's like I was sitting in a restaurant and this person beside me was complaining about how today's youth, they don't respect anybody, they don't respect the flag, they don't respect this. She was going on and on. I had to turn around and say, the classes I teach, whether it's a small class of 20 or the big class of 400, these are remarkable students. I was afraid of leaving this planet Earth to like disaster, but I think we're going to be okay. And so, but it's hard to have faith in someone who's like, barely out of like Maddie was saying, barely out of the crib. not really, but the idea that they have this amazing wisdom and they're going to find solutions to this and they're going to live with these problems. You know, is this a new problem? No. There's a great book on the milk of paradise showing you that 9,000 years ago, opium was as common as you know, bread, and it's not a new problem. But I think that they can have the wisdom to combat these problems, and I think this is where they're a remarkable group, and starting up this something like TACO is just a remarkable commentary on their capacity. And someday, you know, we're going to look back and go, you know, I knew that Maddie person and that Jack guy. I mean, you know, the president and vice president of the U.S. I know those people. Okay, so it could go to that extreme, and I think I feel good. I'm gonna enjoy my dinner tonight. So you guys are great. So I applaud you, and I think parents should be like, you guys, kids are going to an amazing place. Have fun, be safe, and be afraid to try something new. Just kidding. So.
Thank you so much, Dr. Jakowec, for that. Yeah, I don't know about president, maybe Jack will, but we have a wonderful team here at TACO. I could not be more grateful. Everyone on our team is 100% volunteers. No one is paid for what they do. It's truly, we just are working to help students stay safe in this environment, because yes, as Chief Thomas has mentioned, throughout my time at USC in my first 3 years, I just recently graduated, but my freshman year, sophomore year, junior year combined, there were about 35 student lives lost to drug overdose. So that really was the impetus for why we've started this organization. And I hope you all as parents will trust us in knowing that discussing these topics with your kids does have the potential to save their lives. Our idea in starting this was that if we can keep students well informed, we're going to trust them that they're adults and they will make their best decisions. They're not going to knowingly put their lives on the line. And thus far, the USC community has proved us correct in that. That we've been providing this information and these test strips, and since then, no student lives have been lost. So we could not, as an organization, be more grateful to partnerships with IFC and with Chief Thomas at DPS for supporting us, and for the wonderful professors who have given us their time this evening, as they're so very busy, to come and speak with you all, and the people that have helped to inform me as a recently graduated neuroscientist and in starting this organization. So thank you to Dr. Jakowec and Dr. Kim as well. And thank you to you all for being here this evening. We hope that despite how scary some of these topics may be, that you do feel more equipped to have a comprehensive conversation about these things before your child heads off to school. And we do really encourage you to do that. If you have further questions about any of the topics discussed here today, or would like to review this panel, we will make it available on our website, tacoinc.org. That website is also a wealth of information about drugs, drug use, addiction, all of these topics we've discussed here today. That you can find there. So we would encourage you to check that out as well. But thank you all again for being here. On behalf of the TACO team, we wish you a safe, healthy, and happy school year. Thank you all.